Hey, good evening, everybody. Welcome to Microbiology. Small organisms, creepy organisms, waiting to bug you, and you need to discover the correct answer. I'm so happy to see 51 online YouTube players and 46 warriors on the game. Let us see who is going to win 40,000 rupees worth of onlinembbs.com video library, 3,000 video lectures, 1 lakh PowerPoint slides of notes, 30,000 MCQs topic-wise classified Q scanner, 65 full-scale grand tests on every Sunday, along with discussion and daily live online session. Everything is going to be yours if you are the winner. So get ready for the edge of the seat excitement with Dr. Murli Bharadwaj. Every day you have 3 quizzes, 10 a.m., 2 p.m. and 10 p.m. Tonight 10 p.m. also you have pharmacology quiz. So Monday Anat Physio Biochem, Tuesday Micropharma and Pathology. So morning we had pathology quiz and Dr. Sairam was the winner. Let us see who is going to be the winner this time. I'm really excited to see 56 online. We need to kick that 100 plus score. Please invite your friends also. Chalo, shuru kare. 3, 2, 1, start. A 36-year-old sexually active woman presents with a painful vesicle on her external genitalia. Along with that, she is also having bilateral inguinal lymphadenopathy. Very important clue. A Jank smear from the vesicle is negative, and the PCR analysis of the viral DNA is also negative. A VDRL is also negative. Now, what is the medication would be most useful in this given clinical scenario? If you are unable to see, please blow up your screen, go into full screen on the laptop. Typically, questions you should see on the laptop, on the YouTube, and answers you should punch into the Kahoot. Very good. 17 of you are right. You prefer to give ceftriaxone is what you need to remember. Very good. Prachi is on the top, followed by Shweta, Sid, Shweta Reddy, and Guna Sundari. Very good. So looking at all that clinical picture which has been given to you, in a sexually active patient, you should always include primary syphilis, genital herpes, and chancroid. Because the Jank smear, if you do Jank smear, you will be able to see multinucleated germ cells if it were to be herpes infection. You need to do PCR in order to identify herpes virus. And in this case, both of them are negative. Even VDRL is also negative, so not a syphilis. That is the reason chancroid is most likely to be the underlying cause, is what you need to remember. Now comes the next question. A 42-year-old woman, HIV positive, presents with 6 weeks history of worsening hemiparesis. There are visual field defects, cognitive impairment, The patient CD4 plus count is 12. Lumbar puncture is showing a normal opening pressure. Very important clue. CSF analysis is showing mildly elevated protein level. And there is myelin basic protein. And there is mild mononuclear pleocytosis. So what is the most likely possibility for the clinical picture in this given case? Punch your answer, doctor. Who is going to give me an interesting answer for this HIV positive individual? Only 7 of you are right, calling it as JC virus infection. So Prachi is still on the top and Pravalika, Pooja are racing to get the 40,000 rupees prize. So doctor, the MRI is showing several hyperintensities which are not surrounded by edema. So this is all in favor of progressive multifocal leukoencephalopathy, which is caused by the JC virus, is what you have to hit the bullseye. Which virus causes neoplasia? By inactivating the tumor suppressor genes like P53 and retinoblastoma. Easy question. I'm sure all of you will answer this correctly. Punch your answer, doctor. So, which of the following viruses inactivates the tumor suppressor genes like P53 and retinoblastoma? Our quiz is such a thing where the faster you punch the right answer, you are getting to the top of the leaderboard. So that is the entire edge of the seat excitement with Dr. Murli Bharadwaj. Every day to inspire you to go back to the books, to go back to the onlinembbs.com video library and do the revision. So 22 of you are right. Kush Hua Mogambo. So Shweta is on the top, followed by Prachi, Muhurat, Pooja, and HCQ. So very good, Shweta. So human papillomavirus is a carcinoma by the inactivating tumor suppressor genes like P53 and retinoblastoma is what you need to remember. An elderly man develops breathing difficulty, productive cough, joint pain. A PPD, MAN2 is negative, but a tissue specimen from the biopsy reveals a fungus which has got endospores containing spherules when you grow at 37 degrees and branched hyphae when you grow at 25 degrees. Precisely, we are talking about a dimorphic fungus. What is the most likely cause, doctor? Who is going to give me the correct answer? In this elderly man with breathing difficulty, productive cough, joint pain, radiograph given, all that clinical vignette must be able to pinpoint to one answer. What is that answer? 24 of you are clean board thinking it as aspergillus. The most common wrong answer. Only 8 of you are right. So that is changing your PRP rating. Guna Sundari is also our Gyan Sundari. Excellent Sundari. Very proud of you. In fact, my mother's name is also Bala Tripura Sundari. My mom, she was a great Carnatic singer, musician, and always the sweetest mom that ever anyone can have. Of course, every mom is a sweet mom. So the word Sundari strikes a big crush in my heart. So good, excellent, doctor. Now, please remember, coccidioides immitis is the classical infection where it is a dimorphic fungus is with all those features is what you need to remember. A neonate with purulent umbilical discharge for 2 days with fever, irritability, diffuse flushing. 2 days later, there are large fluid-filled blisters that leave a raw area. The grand stain of the peripheral blood smear is being shown to you. And the symptoms of his skin are because of the separation of what layer of the skin. So first of all, if you can recognize based on this story, what is this organism? You know what I'm talking about, and accordingly you will crack the right answer. So let us see. A neonate with purulent umbilical discharge. 8 of you are right. The layer of separation is at the level of the stratum granulosum is what you need to remember. Very good. Shweta, Gunasundari are on the top, and Vaishu is really quickly picking up. Very good. So, doctor, they are all gram-positive cocci in clusters. So, what the clinical picture is all about, staphylococcal scalded skin syndrome is what you need to remember. Now, a 54-year-old man develops non-bloody watery diarrhea working as a construction worker in New Delhi. He arrived in the area 2 days ago. A stool smear shows no WBCs. Now he develops dehydration, electrolyte abnormalities, leading to cardiac failure, renal failure. What is the organism leading to all these dramatic changes is the examiner's favorite question. Punch your answer, doctor. Considering the entire clinical picture. So, doctor, don't forget, tonight once more at 10 p.m. we have pharmacology quiz tournament. Please invite more number of your friends. I want to see 100+ online students fighting every time in the quiz tournament. 17 of you are right. Delhi belly. So watery diarrhea, Vibrio cholera, what else it can be? Excellent. Shweta is on the top. Oh no, Gunasundari, you have gone down. But no worries. 001, Pooja and Sid are closely competing to snatch that 40,000 rupees crown of onlineMBBS.com subscription. So, doctor, Vibrio cholera leads to watery diarrhea, rice water stool, and the cholera toxin, you should remember, excess cyclic AMP is a very important underlying mechanism of the toxin. A 26-year-old woman presents with vaginal itching, burning, and on examination she has a foul-smelling greenish discharge. A pap smear is being shown to you. Looking at it, what is your diagnosis and what is your treatment? Come on, doctor. You are all corona doctors, corona generation, right? So we are all living, loving, existing in the world of infections around us, pandemics and epidemics. See, unimaginable. So that is the reason, more than cardiology, more than rheumatology, endocrinology, neurology today, most popular is coronology, right? So DM coronology. Very good. Very good. Very good. 30 of you have rightly answered as metronidazole. Easy question. Oh my God, 001 is on the top, followed by Pooja, Sid, and Shweta. Excellent. So pap smear shows trichomonas vaginalis. So that foul-smelling, greenish discharge, itching, burning, everything. All of you know trichomonas, sexually transmitted. That's the reason even partner need to be treated. And on the microscope, you are seeing the trophozoites. Metronidazole is considered to be the treatment, is what you need to remember. A 62-year-old man presents to the emergency department with sharp retrosternal pain radiating to his back and arms. Simply speaking, this ECG, based on the ECG appearance, what do you conclude? And what is the most likely microorganism leading to it? Microorganism leading to it. So basically, of course, the ECG is very small looking. You need to blow up the YouTube into full screen, then only you can appreciate. By now you know the answer. 19 of you are right. Coxsackie virus. Coxsackie virus. Oh my God, Shweta is our cardiologist. Ex officio. Very good. So, Shweta, what is your dream branch? So, she's on the top of the leaderboard. Very good. So, doctor, a widespread ST elevation with a PR depression, which is a very important clue in this given story, which is suggestive of pericarditis. Pericarditis and Coxsackie is what you need to remember. A 12-year-old boy is brought by his parents because of the fever and sore throat. He has tonsillar exudates, swollen, tender anterior cervical lymph nodes. No history of cough. The gram stain of the tonsillar exudate is being shown to you. Once more, you can appreciate. Oh, Ahmed, I'm really sorry to know that. You need not come through the app, Ahmed. What you can do is, instead of entering through the app, you can always do kahoot.it. Kahoot.it. Simply it will ask PIN number. Just through your browser, you come through kahoot.it. I'm typing here. I'm really sorry about that, Praveen and Ahmed. Very good. Catalase negative, beta hemolytic, bacitracin sensitive organism. Wow. Manu is on the top. Sesha followed by Vaishyu. Very good. Very good. So you need to be doubly sure, doctor. Oh, you're on the website? Oh, then it should not be a problem. But anyway, doctor, shortly, by about August 1st, we will be releasing a mobile app of Incus. Starting from 9 a.m., 10 a.m., 11 a.m., 12 a.m., 12 p.m. until night at 12 o'clock. Morning 9 a.m. to 12 o'clock. Every hour you have a quiz tournament covering 19 subjects in a single day. But the only difference is you don't have Dr. Murali Bharadwaj anchoring you. Of course, we will also be developing a application where anchor-driven live quiz shows are also done. But in the first version, we will have only the quizzes with a good music, with a lot of friends fighting and the leaderboard, everything to give you that edge of the seat excitement. So even in those tournaments, if you happen to become the winner, you still get 40,000 rupees worth of online mbbs.com video library subscription as the prize. So let us see. Shortly we are coming up with our own mobile app. So doctor, a 27-year-old on serological testing is negative for envelope antigen and surface antigen. But he is positive for surface antibody and core antibody, HBCAB of IgG type. Right? So what do you like to conclude based upon this serology is the examiner's question. Punch your answer, doctor. Yes. 27-year-old woman on serological testing. Very good, very good. 11 of you have correctly answered. The serological profile where he is negative for envelope antigen means it's not proliferating. And negative for surface antigen means he is immune. And positive for HBsAg. So that's the reason the patient is exposed to hepatitis B and has completely recovered. Is the inference is what you should remember. Very good. 001 once more springs up with a correct answer. Excellent, doctor. Excellent. So this is a real rat race. So now, doctor, the next question. A sexually active 14-year-old boy comes to the physician because of the rash on his trunk and genital area. Physical examination reveals the findings shown in the image. So, what is the type of virus most likely this juvenile kid might have acquired based upon the physical examination findings? So, doctor, those who are able to get the first rank, you get rupees 40,000. But those who got second to 10th rank, please don't forget to call our helpline 9000-868-356 and you have a surprise discount waiting for you because we want more students to be part of our online MBBS cohort, right? So every year we conduct 1,000 anchor-driven tournaments. Every day 3 tournaments anchor-driven, where teacher or another teacher will drive you. So we are creating a super 1,000 batch of Dr. Murali Bharadwaj who will be able to win the quizzes and get into the top position and tomorrow also prove that they're on the top of the NEET PG entrance exam merit list. So please inform all your friends and make them also to join the quiz every day. The more the merry as we keep fighting. 001 is on the top, followed by Sid, Shweta, Manu and Seisha. So doctor, based upon the clinical findings, molluscum contagiosum caused by pox virus is the one which you have seen. What's the most important reason why influenza virus Type A caused the sporadic worldwide epidemics. What is the main reason? Epidemics are because of what? Pandemics are because of what? You have to be 100% sure about the terminology in microbiology. Yes. Punch your answer, doctor. Very good. So, punching is one thing, punching fast and punching correctly. That is what entrance is all about. NEET is all about precision, focus, depth, perseverance, and perception. 18 of you are right. Antigenic shift is responsible for the sporadic worldwide epidemics, is what you need to remember. That brings Manu, Sesha, superior vena cava, and Vaishu. Come to the top. Very good. So, influenza virus has both hemagglutinin, neuraminidase molecules, and it is that antigenicity structure variability which is mainly responsible. Now, a 3-year-old boy presents with the classical meningitis triad: fever, headache, nuchal rigidity. A lumbar puncture is showing PMS, increased protein, decreased glucose. What is the most common cause of the meningitis in a child of this age with this given clinical picture is a very, very important question to all of you. Considering the LP findings, the age of the patient, what do you think the most likely cause for the meningitis in this given kid? Very good. Fourteen of you are right. Streptococcus pneumoniae is the one which you need to think. That keeps Manu, Shweta, Sesha are trying their best to take away the crown from 001. Let us see. Good to see Shakti really speeding up. So it is all consistent with bacterial meningitis, and the most common cause of the meningitis between 6 months to 6 years, the bacterial meningitis is Streptococcus pneumoniae, is what you need to remember. 36 hours after the placement of a catheter, a hospitalized patient developed a fever and chills. Within 2 hours, her systolic BP falls. She develops swelling in the extremities. The X-ray of the patient lungs taken hours before she passed is being shown to you. So, what is the mediator? Most likely responsible for this pathology. Sairam asked a very good question for our earlier point. Exactly. H influenza, now we are giving vaccination, which will which changed the most commons. Very good to see Alonia Medelia. You are from which part of the world, Alonia? Very good. 8 of you are right. It is the C3A is what you need to remember. Oh my God. 001 is rocking with 6 correct answers in a row, followed by Manu, superior vena cava, Pooja, and Shweta. So, doctor, typically the X-ray is showing pulmonary edema. So there is an endotoxic shock, and it is the C3A component of the complement cascade, mainly responsible for the hypertension and edema, is what you need to remember. The last question, which is going to decide who is going to be the winner. Get ready, get ready, get ready for a fight. Spardaya Vardhate Vidya. You should fight, get inspired, and go back to the onlinembbs.com video library and get motivated to study every day. That's the only secret of winning. So, rapidly progressive meningoencephalitis, 40-year-old man who developed it after swimming in a freshwater lake. So, what is the most likely organism responsible given that history? Very good. "24 of you are right. Naegleria fowleri is the organism that you need to remember." Whoa, that's wonderful. In a row of 7, 001 is on the top. Excellent. So Naegleria fowleri is the one which presents with rapidly progressive meningoencephalitis that progresses to coma or death within 6 days is what you need to remember. Now, doctor, it is the time to give over the prizes. Superior vena cava in position 3. Manu is in position 2. 001 on the top position. Pooja and Shweta are the runners. But don't worry. Once more, 10 p.m. tonight, you are having the pharmacology quiz. And in this pharmacology quiz, Pooja and Shweta, you may turn out to become the toppers and get your 40,000 rupees worth of onlinembbs.com video library. Bring more and more of your friends to fight every quiz tournament with Dr. Murli. Congratulations, 001. So I wish to see you all in the evening. And those who are in 2nd to 10th position, please do call today only with a screenshot and tell our helpline that you are in 2nd to 10th. You have got a surprise discount at a throwaway price to subscribe, get the subscription of onlinembbs.com video library. Good night and see you once more at 10 p.m. Bye-bye.